Commercial dental insurance, as well as the West Virginia Medicaid card and the West Virginia CHIPS card, cover comprehensive dental care, including preventive care and restorative care for children. The role of nutrition and good oral health will be looked at in further detail in the next chapter. However, as we learned in a previous chapter, our eating habits and types of food play an important role in tooth decay. Two things to consider when eating sugary foods is frequency and duration. Frequency is how often we expose our teeth to sugar, and duration is how long the sugar remains in the mouth. The longer the sugary snack is in the mouth, an example being gooey, sticky candy that sticks to the teeth, or lollipops that are in the mouth a long time, the greater the risk for tooth decay. Remember, we transfer our eating habits to our children, so model good nutrition for your child. Your oral health will benefit also. ECC stands for Early Childhood Caries, and that means any tooth decay that occurs in any child under the age of 6 years of age. Baby bottle tooth decay, or nursing bottle caries, is a severe and virulent, which means strong and fast occurring form of early childhood caries that begins in the top 4 front teeth. This occurs from bedtime or nap time use of a bottle containing juice, milk, formula, or any other liquid sweetened with fermentable carbohydrates or sugars. The same result can occur if cereal is added to a bottle. Additionally, inappropriate daytime bottle feeding of children can lead to nursing bottle caries or baby bottle tooth decay, depending on the contents as well as the frequency and duration of use of the bottle. A white spot lesion is caused by the demineralization of the enamel underneath the surface by the acid production of the bacteria in the plaque, and is widely considered a precursor of dental caries. These can be reversed. White spot lesions, they can be reversed with proper hygiene and fluoride therapy provided by a dental professional. The dark area at the gum line is what a white spot lesion progresses to, a tooth cavity. At this point in time, a tooth cavity would require a dental restoration, or better known as a dental filling. Identifying white spot lesions before they become a cavity is one of your goals as a parent, using the lift the lip technique of the oral examination when brushing a child's teeth that we learned previously. We now see severe destruction of the primary teeth in early childhood caries. This child's quality of life has suffered immensely and will require multiple extractions, most likely in a hospital setting, resulting in a heavy human and financial cost. To prevent early childhood caries, do not put your infant to sleep with a bottle or sippy cup, or allow frequent and prolonged bottle feedings or use of a sippy cup containing beverages high in sugar, such as fruit drinks, sports drinks, soda pop, fruit juice, milk, or formula during the day or at night. You as a parent should encourage your infant to drink from a sippy cup as they approach their first birthday. Infants should be weaned from the bottle at 12 to 14 months of age. Remember, between meals, only fluoridated water should be used in a bottle or sippy cup. Juices and milk can be used during meals, as the mechanical action of chewing will help cleanse the teeth. Also, ad-lib nighttime breastfeeding should be avoided after the eruption of the first primary tooth. To provide your child with good oral health, it is important that your child be exposed to fluoride. Fluoride is what dental professionals use to treat white spot lesions discussed earlier. There are 2 methods of delivery for fluoride. They are systemic and topical. If you have a community-supplied fluoridated water source, use it for cooking and drinking. If you have well water or cistern water as your water source, ask your physician or dentist to test it for fluoride content so that they can provide you with the proper information you need to be certain that your child gets the appropriate amount of fluoride. Remember to discuss with your physician and dentist your child's daily routine, and also remember to discuss with your physician or dentist if you move or change water sources. If you prefer to use bottled water, use bottled water that has fluoride added, such as nursery water, or bottled water that clearly states on the label that fluoride has been added. Now that we've talked about systemic fluoride, let's talk about topical fluoride. There are many examples of topical fluoride, such as fluoride in toothpaste, fluoride home rinses, as well as the concentrated fluoride gels and fluoride varnishes that are used in dental offices. Remember, fluoride rinses are not recommended for children under the age of 6 due to the risk of swallowing the rinse. Any child over the age of 6 that elects to use a fluoride rinse should have adult supervision when using the rinse. Earlier, we demonstrated the appropriate amount of toothpaste to use when brushing a child's teeth. This is important because we recognize that a young child will not have the ability to spit out after brushing and will swallow the toothpaste. Therefore, we only use a horizontal smear of toothpaste for a child under 2 and a pea-sized shape of toothpaste for children over 2. Remember to encourage a child to spit out after you have brushed their teeth when they are capable of doing so. This picture shows a child having fluoride varnish applied to their teeth by a dentist. Ask your dentist or dental hygienist about fluoride varnishes and if they're right for your child. Each and every one of us has a role and responsibility to ensure our children's oral health success. Understanding, distributing, preaching, and practicing the anticipatory guidance that has been discussed in this chapter can lead our children to a healthy head start in life.